Well, 3 months in, it's hard to tell what impact legal marijuana is having on the world's sixth biggest economy in the state of California. Is the Golden State getting hooked on pot? A drug addiction counselor says, yeah, they are. Well, California started selling recreational marijuana this past New Year's Day, and it's a profitable business for the state, as we have seen in Colorado. Early numbers suggest that dispensaries in the state could earn nearly $4 billion this year in sales. But money aside, an addiction specialist says he's seeing a negative effect, a major spike in the number of people who come in for marijuana addiction treatment. Addiction specialist Koorosh Rassekh joins me now. So you say that you see a major spike in residential treatment referrals. What type of numbers do you have to support that? What are you seeing since it's been legalized?
Hi, thank you for having me on. I don't necessarily have numbers. The legalization only happened a few months ago. But a very disturbing trend that we've been seeing, actually beginning when medical use of marijuana came into the state, has been people coming in treatment and emergency rooms and hospitals with symptoms that were reserved for substances like heroin or crystal meth. People are delusional, they are in psychotic breaks, they're completely paranoid, and that is very disturbing.
We have seen cases like that when it's been edibles in Colorado. Is that the same case that you are seeing in terms of how they use marijuana?
Yeah, so there's a whole variety of highly concentrated products that are now being produced. Edibles, tinctures, oils, and even the plants that are used to smoke are so much stronger than they used to be that people are actually just getting blindsided by the effects of what they're experiencing relative to what they thought they were going to experience.
So hospitalization, though, is different than being addicted to a drug, if I'm right. So can you be addicted to marijuana? There are some studies that say you can't be physically.
Absolutely. If we think about what leads to addiction, people can use marijuana recreationally if they enjoy its effects. And we certainly have enough evidence that there are some really powerful uses medically for certain conditions. And then there are people who turn to substances, including marijuana, as a coping strategy to deal with pain or other benefits that they get from it that they are not getting in their day-to-day life.
So with other drugs or just solely marijuana use have you seen?
Well, no, I think this happens with all sorts of drugs, including marijuana use. For a long time, we've excluded marijuana from other drugs in terms of its habit-forming potential. But those of us in the addiction treatment world and in the medical world have known for a long time that developing a habit, developing dependence, developing addiction to marijuana is possible in the same way that it's possible with other substances. It's just now much more prevalent as the marijuana and the byproducts, the other products being made with concentrated forms, are so much stronger.
There are so many reports on this. In Colorado, they say that teen drug use is down in a Washington Post article. So the debate continues as it becomes legal state to state. Koorosh, thank you so much. We'll be right back.
Thank you again.